Hi, I'm Kayla Broeker, and this is Lydia, and I did my internship at Tigertown Animal Hospital. First, I'll take you on a quick tour. This is the front desk and lobby where we greet clients and can look up everything we need on the computer using the Avamark system, and also have a scale for large dogs. This is our back treatment area where we can fill prescriptions, prep for surgery, and do tests like fecals. This is our isolation room, where we can contain contagious patients like puppies with parvo. And we also have a medication board here where we keep track of what our current patients need. Here's one of our 2 exam rooms where we'll take appointments and take temperatures and give vaccines. Here's our drug cabinet and some of the medications we stock. The cabinets are sorted by the type of drug. That's a fluid pump and some IV fluids like a lactating ringer solution. I actually placed the IV catheter in that cat because he has a severe upper respiratory infection and was dehydrated. Here's the rest of our treatment kennels where cats and hospitalized patients stay. And here's our back kennels and kitchen area, also the washer and dryer. Our vet is Dr. Nathan Craddock, and this is his office. These are Fathead and Minnie, our 2 clinic cats who think that they're the ones who actually run the place. They're both strays that we took in and rehabilitated, and the clients love them. One of my main responsibilities, besides helping with appointments, is helping prepare for surgeries. Here's the medications we give every surgery patient based on their weight. Exenel is an antibiotic, butorphanol is a painkiller and sedative, and Metacam is also a painkiller. Propofol is what we use to sedate dogs. Here's our setup for intubation and our anesthesia machine. Since the dog being spayed is under 10 pounds, we're using a non-rebreather. Otherwise, we would have a bag connected to the machine. Here I am injecting the propofol into the cephalic vein on the front leg of the dog. And it's right in the middle, right at the top. If blood appears when you draw back on the syringe once you've inserted it, you've hit the vein and you can inject the drug. Sometimes the vein will blow if you don't have it placed correctly or if you inject too quickly. You can also mask down a patient directly, most commonly with cats, and we have masks of different sizes for that. Here I am about to intubate by placing an endotracheal tube down the trachea with the help of a laryngoscope, which has a light on it. With cats, it's much harder. The tube is then tied in using some gauze. And that's our head vet tech, Miss Lynn, helping me, by the way. It does take 2 people to do this. After you tie in the tube, you have to inflate the cuff of the tube to help keep it in place. If you inflate it too much, you can damage the tube, though. The cuff attached to that tube connects to an inflatable bag of sorts at the end of the endotracheal tube. The dog is then shaved from right below the rib cage and to the nipples on either side. Here I am giving the medication subcutaneously under the skin to our second surgery patient of the day, who is a cat also getting spayed. We try to give the drugs in different sites to prevent it from irritating the patient too much. So that the bladder doesn't get in the way of the surgery, it must be expressed. We sterilize the incision site using chlorhexidine scrub and alcohol 3 times. We've also set out sterile gloves, suture, and a scalpel with the sterilized instrument pack for Dr. Craddock to use. The animal is also tied down to keep it stable. Then Dr. Craddock performs the spay. I hope this video was informative. Thank you.